Question 1. The primary mission of the Central Service CS Department is to A. Provide direct patient care. B. Ensure patient safety by providing high-quality, reprocessed medical devices. C. Manage hospital finances and billing. D. Conduct medical research. Answer: B. Ensure patient safety by providing high-quality, reprocessed medical devices. The concept tested here is the fundamental purpose of the Central Service Department. The keyword primary mission emphasizes its core role, which is centered on patient safety through meticulously cleaned, disinfected, and sterilized medical devices. Central Service technicians are crucial because they ensure instruments are safe for patient use, preventing infections, and supporting successful surgical outcomes. For instance, without properly processed instruments, a surgical procedure could lead to a severe patient infection. Remember, the CS department directly contributes to patient safety by ensuring every instrument is ready for its next use. Question 2. Which of the following professional organizations is primarily responsible for developing standards and guidelines for the processing of reusable medical devices? A. American Medical Association, AMA. B. Association for the Advancement of Medical Instrumentation, AAMI. C. American Nurses Association, ANA. D. Occupational Safety and Health Administration, OSHA. Answer: B. Association for the Advancement of Medical Instrumentation, AAMI. This question tests knowledge of key professional organizations relevant to Central Service. The keyword standards and guidelines points directly to the role of AAMI, which is recognized as the leading source for best practices in medical device processing, sterilization, and related equipment. Unlike regulatory bodies like OSHA, AAMI focuses on developing voluntary standards that facilities adopt to ensure safety and quality. For example, AAMI provides detailed instructions on how to properly clean and sterilize surgical instruments. Always remember that AAMI is your go-to for understanding the proper procedures for instrument processing. Question 3. What is the main reason for strict adherence to standard precautions in the Central Service Department? A. To prevent equipment damage. B. To reduce the risk of healthcare-associated infections, HAIs. C. To speed up the processing workflow. D. To lower operational costs. Answer: B. To reduce the risk of healthcare-associated infections, HAIs. This question focuses on the crucial concept of standard precautions and their impact on patient and staff safety. The phrase main reason highlights the core objective, which is preventing the spread of germs that can cause serious infections in healthcare settings. Standard precautions treat all bodily fluids as potentially infectious, protecting both the healthcare worker and the patient from transmission of diseases. For example, wearing gloves when handling soiled instruments prevents pathogens from getting on your skin and spreading. Adhering to these precautions is foundational to maintaining a safe environment and preventing HAIs. Question 4. What does the acronym PPE stand for in the context of Central Service safety? A. Patient placement equipment. B. Personal protective equipment. C. Professional patient education. D. Primary processing efficiency. Answer: B. Personal protective equipment. This question assesses your understanding of fundamental safety terminology in the Central Service environment. The acronym PPE is a crucial term, and recognizing it as personal protective equipment is essential for safety. PPE includes items like gloves, gowns, masks, and eye protection, which are designed to protect healthcare workers from exposure to blood, body fluids, and other hazardous materials. For instance, wearing a fluid-resistant gown and face shield in the decontamination area protects you from splashes during instrument cleaning. Always remember that PPE is your first line of defense against workplace hazards. Question 5. Why is maintaining patient confidentiality, HIPAA, vital in the Central Service Department? A. To ensure instruments are processed quickly. B. To protect patient privacy and trust. C. To reduce the cost of medical supplies. D. To improve staff communication skills. Answer: B. To protect patient privacy and trust. This question tests the ethical and legal concept of patient confidentiality, specifically related to HIPAA. The phrase vital in the Central Service Department emphasizes that even though CS technicians don't directly interact with patients, they may encounter patient information on instrument trays or schedules. Protecting patient privacy and trust is a fundamental right and a legal requirement under HIPAA, Health Insurance Portability and Accountability Act. For example, knowing a patient's name on a surgery schedule means you must not share that information with anyone not directly involved in their care. Always remember that maintaining confidentiality builds trust within the healthcare system and is a serious ethical responsibility. Question 6. The Occupational Safety and Health Administration, OSHA, primarily focuses on A. Setting standards for sterile processing techniques. B. Ensuring a safe and healthy work environment. C. Regulating the design of medical devices. D. Certifying central service technicians. Answer: B. Ensuring a safe and healthy work environment. This question assesses your knowledge of a key regulatory agency, OSHA. The keyword primarily highlights OSHA's main objective, which is to protect workers from hazards in the workplace by setting and enforcing standards. OSHA establishes regulations concerning things like bloodborne pathogens, hazardous chemicals, and ergonomics to prevent injuries and illnesses among employees. For example, OSHA standards dictate proper ventilation and the use of personal protective equipment in the decontamination area. Remember, OSHA is all about keeping you safe at work. Question 7. Early efforts to control infections in healthcare settings were significantly influenced by the work of A. Marie Curie. B. Florence Nightingale. C. Albert Einstein. D. Alexander Fleming. Answer: B. Florence Nightingale. This question touches on the historical context of infection control, a foundational concept for central service. Florence Nightingale, a pioneer in nursing, dramatically reduced mortality rates in hospitals by emphasizing sanitation, hygiene, and proper environmental conditions. Her work laid early groundwork for understanding how cleanliness directly impacts patient outcomes, influencing practices that would eventually lead to modern infection prevention. For instance, her insistence on clean linens and good ventilation directly relates to principles of aseptic technique. Remember Florence Nightingale as a key figure in the history of infection control. Question 8. Aseptic technique is best described as A. Any method that quickly processes instruments. B. Procedures performed to prevent contamination. C. The process of sterilizing instruments. D. The cleaning of surgical suites. Answer: B. Procedures performed to prevent contamination. This question defines the core concept of aseptic technique, which is fundamental to preventing infections in healthcare. The phrase best described as asks for the most accurate and comprehensive definition. Aseptic technique encompasses practices that create and maintain a sterile field, preventing microorganisms from reaching susceptible sites during medical procedures. For example, using sterile gloves and instruments during surgery is an application of aseptic technique to avoid introducing bacteria into a patient's body. Always think of aseptic technique as a set of actions designed to keep things clean and free from harmful germs. Question 9. Effective communication within the Central Service Department is crucial for A. Increasing the speed of instrument sterilization only. B. Ensuring proper instrument processing and patient safety. C. Reducing the need for new equipment purchases. D. Limiting the scope of technician responsibilities. Answer: B. Ensuring proper instrument processing and patient safety. This question highlights the importance of effective communication in a healthcare setting, specifically within CS. The term Crucial 4 emphasizes its vital role, connecting it directly to core outcomes like accurate instrument processing and, ultimately, patient safety. Clear communication prevents errors, such as misidentifying instruments or misunderstanding processing instructions. For example, a clear handover between shifts about an instrument's status ensures continuity of care and prevents delays or incorrect processing. Good communication is the backbone of efficient and safe operations in central service. Question 10. What is the primary purpose of quality assurance (QA) programs in central service? A. To minimize the amount of paperwork. B. To ensure that products and services meet established standards. C. To increase the speed of instrument distribution. D. To reduce the number of staff required. Answer: B. To ensure that products and services meet established standards. This question addresses the concept of quality assurance within the Central Service Department. The primary purpose of QA is to consistently verify that all processes, from cleaning to sterilization and storage, meet predefined quality benchmarks. This systematic approach identifies and corrects potential issues before they impact patient care, ensuring reliability and safety. For instance, daily biological indicator tests on sterilizers are a QA measure to confirm the equipment is effectively killing microorganisms. Remember that quality assurance is all about consistently delivering excellence and ensuring everything is done correctly. Question 11. Which of the following is not a primary responsibility of a central service technician? A. Decontamination of surgical instruments. B. Assembly and packaging of instrument sets. C. Direct patient care and medication administration. D. Sterilization of medical devices. Answer: C. Direct patient care and medication administration. This question tests your understanding of the scope of a central service technician's role. The keyword "not a primary responsibility" requires you to identify an activity that falls outside the typical duties of a CS technician. While CS technicians are vital to patient safety, their role is indirect, focusing on preparing and managing medical devices rather than direct patient interaction or administering medications. For example, a CS technician meticulously cleans an instrument, but a nurse administers medication to a patient. Remember that CS technicians are the behind-the-scenes heroes, not directly caring for patients at the bedside. Question 12. Following established standards and guidelines in central service is essential primarily because it A. Makes the department more profitable. B. Ensures consistent quality and patient safety. C. Reduces the need for staff training. D. Allows for faster processing of instruments. Answer: B. Ensures consistent quality and patient safety. This question emphasizes the fundamental importance of adhering to standards and guidelines in central service. The word essential highlights the critical nature of these practices, which directly link to maintaining consistent quality in device processing and, ultimately, protecting patients from harm. Standards provide a repeatable framework that ensures every instrument is processed correctly, regardless of who is performing the task. For example, following a standard operating procedure for instrument inspection ensures that no damaged instruments are sent for sterilization. Consistency in following standards directly leads to predictable and safe outcomes for patients. Question 13. The Joint Commission, TJC, is an organization that A. Manufactures surgical instruments. B. Provides accreditation to healthcare organizations. C. Develops hospital construction blueprints. D. Manages healthcare insurance claims. Answer: B. Provides accreditation to healthcare organizations. This question assesses your knowledge of TJC, a significant organization in healthcare regulation. The phrase is an organization that requires you to identify its primary function. The Joint Commission surveys healthcare facilities to ensure they meet quality and safety standards, and successful adherence results in accreditation, which is crucial for hospitals. For example, TJC's surveys often include scrutinizing central service practices to ensure proper instrument sterilization. Remember that TJC's main role is to assess and accredit healthcare facilities, promoting high standards of patient care. Question 14. To prevent sharps injuries, central service technicians should: A. Immediately recap needles after use. B. Place sharps in regular trash bins. C. Use sharps containers for disposal. D. Hand sharps directly to other staff members. Answer: C. Use sharps containers for disposal. This question focuses on a critical safety practice in the Central Service Department regarding sharps. The goal is to prevent injuries, and the correct method for handling sharps is to always use designated, puncture-resistant sharps containers for disposal. Recapping needles or placing sharps in regular trash bins are dangerous practices that increase the risk of needle stick injuries. For example, after disassembling an instrument with a sharp component, you should place that component directly into a sharps container. Always prioritize safety by correctly disposing of sharps. Question 15. Continuous professional development for central service technicians is important because it: A. Reduces the need for supervisory oversight. B. Ensures staff are aware of new technologies and best practices. C. Primarily focuses on increasing technician salaries. D. Limits communication with other departments. Answer: B. Ensures staff are aware of new technologies and best practices. This question addresses the concept of continuous professional development, which is vital in a rapidly evolving field like central service. The reason it's important is that medical devices, processing technologies, and regulatory requirements are constantly changing. Ongoing education ensures technicians stay updated, maintain competence, and can adapt to new procedures, ultimately improving patient safety. For instance, attending a workshop on a new sterilization method helps technicians remain proficient and safe. Staying current with your knowledge is essential for providing the best possible service. Question 16. What is the role of the Food and Drug Administration, FDA, regarding medical devices? A. To ensure healthcare worker safety in the workplace. B. To regulate the manufacturing and marketing of medical devices. C. To provide accreditation for hospitals. D. To develop standards for surgical procedures. Answer: B. To regulate the manufacturing and marketing of medical devices. This question tests your knowledge of the FDA's role in the context of medical devices. The FDA is a federal agency responsible for protecting public health by ensuring the safety, efficacy, and security of medical devices, including those used and reprocessed in central service. This oversight involves approving new devices before they can be marketed and monitoring their safety after they are in use. For example, the FDA reviews data from manufacturers to ensure a new surgical instrument is safe and effective before it's sold. The FDA makes sure medical devices are safe for patient use from the start. Question 17. An ethical principle that requires central service technicians to be honest and truthful in their work is: A. Fidelity. B. Beneficence. C. Veracity. D. Justice. Answer: C. Veracity. This question explores an important ethical principle relevant to professional conduct in central service. The core concept here is honesty and truthfulness. Veracity specifically means the obligation to tell the truth and not deceive others, which is critical for maintaining trust within the healthcare team and ensuring accurate documentation. For example, if a technician notices a damaged instrument that was supposed to be perfect, veracity requires them to report it honestly rather than try to hide it. Always remember that veracity means being truthful in all your actions and communications. Question 18. Ergonomic practices in the Central Service Department are primarily aimed at A. Increasing the speed of instrument assembly. B. Reducing staff injuries and musculoskeletal disorders. C. Improving the visual appeal of the department. D. Lowering the cost of utility bills. Answer: B. Reducing staff injuries and musculoskeletal disorders. This question focuses on the practical application of ergonomics in the workplace. The term primarily aimed at directs you to the main benefit of ergonomic principles, which is to design work tasks and environments to fit the worker, thereby preventing strain, fatigue, and injuries. In central service, this might involve adjusting workstation heights or using proper lifting techniques to protect technicians' bodies. For example, using a cart to move heavy instrument trays instead of carrying them prevents back strain. Practicing good ergonomics keeps you safe and healthy while performing your duties. Question 19. Why is accurate and thorough documentation essential in the Central Service Department? A. To impress auditors during inspections. B. To track instrument processing, identify issues, and ensure accountability. C. To reduce the number of instruments needed in inventory. D. To speed up the instrument decontamination process. Answer: B. To track instrument processing, identify issues, and ensure accountability. This question highlights the critical role of documentation in central service. Accurate documentation is essential because it provides a complete record of every step in the instrument processing cycle, from decontamination to sterilization and storage. This record allows for traceability, helps identify potential problems if an infection occurs, and ensures accountability for proper procedures. For instance, recording the sterilizer load number helps link a patient's surgical outcome back to specific instrument processing data. Remember, if it wasn't documented, it wasn't done, and good documentation protects both patients and staff. Question 20. The decontamination area in central service is where? A. Instruments are sterilized and stored. B. Clean instruments are assembled into sets. C. Soiled instruments are received, sorted, and cleaned. D. Sterile supplies are issued to patient care areas. Answer: C. Soiled instruments are received, sorted, and cleaned. This question tests your knowledge of the distinct zones within the Central Service Department. The decontamination area is the dirty side, where instruments contaminated with blood and tissue from patient use are initially handled. It is crucial for this area to be physically separated to prevent the spread of microorganisms to other, cleaner areas. For example, technicians in this area wear heavy-duty personal protective equipment to protect themselves while performing initial cleaning. Decontamination is the first critical step in making instruments safe for reprocessing. Question 21. Which of the following is an example of an unethical action in the Central Service Department? A. Reporting a damaged instrument. B. Following all safety protocols. C. Ignoring a misstep in instrument processing to save time. D. Collaborating with other departments for efficiency. Answer: C. Ignoring a misstep in instrument processing to save time. This question directly addresses ethical behavior in the workplace. The keyword unethical action points to a behavior that violates professional and moral standards, which is clearly demonstrated by compromising patient safety for convenience. Ignoring a missed step directly jeopardizes the patient by potentially allowing an improperly processed instrument to be used. For example, if you skip a manual cleaning step, residual organic material could prevent effective sterilization, leading to infection. Always remember that patient safety and proper processing procedures must never be compromised, regardless of time constraints. Question 22. The main goal of continuous quality improvement, CQI, in central service is to A. Blame individuals for mistakes. B. Continuously identify and improve processes. C. Reduce the overall staffing level. D. Only focus on financial savings. Answer: B. Continuously identify and improve processes. This question defines the core principle of continuous quality improvement, CQI. The main goal of CQI is a proactive approach to consistently seek out areas for improvement in all aspects of central service operations, rather than just reacting to errors. It emphasizes an ongoing cycle of planning, doing, checking, and acting to enhance efficiency, safety, and effectiveness. For example, if a certain instrument set frequently comes back incomplete, CQI would involve analyzing why and implementing a new check-off procedure. CQI is about making every process better, all the time. Question 23. What is the correct flow for instruments through the Central Service Department? A. Assembly, decontamination, sterilization, storage. B. Decontamination, assembly, sterilization, storage. C. Sterilization, decontamination, assembly, storage. D. Storage, sterilization, decontamination, assembly. Answer: B. Decontamination, assembly, sterilization, storage. This question tests your understanding of the logical and mandatory workflow within the Central Service Department, which is designed to prevent cross-contamination. Instruments must first be decontaminated to remove gross soil, then assembled and packaged, followed by sterilization to kill microorganisms, and finally stored in a sterile environment until needed. This unidirectional flow ensures that dirty and clean items never mix. For example, instruments never move from the sterile storage area back into decontamination without being used on a patient first. Understanding this flow is fundamental to preventing infections and maintaining sterility. Question 24. A critical component of professional behavior for a central service technician is A. Gossiping about other departments. B. Maintaining a positive attitude and willingness to learn. C. Avoiding any communication with other staff. D. Refusing to perform tasks outside of your exact job description. Answer: B. Maintaining a positive attitude and willingness to learn. This question focuses on the concept of professional behavior in the workplace. A critical component of professionalism involves having a positive outlook, being open to new knowledge, and demonstrating a commitment to growth. This attitude fosters a collaborative environment, supports teamwork, and ensures that technicians can adapt to new procedures and technologies, which benefits patient safety. For example, readily learning about a new instrument processing protocol shows commitment to your role. Remember that being positive and eager to learn makes you a valuable team member and helps you excel. Question 25. The ultimate goal of all central service activities is A. To minimize labor costs. B. To ensure optimal patient outcomes. C. To exclusively handle surgical instruments. D. To increase the hospital's reputation. Answer: B. To ensure optimal patient outcomes. This question asks about the overarching purpose of the entire Central Service Department. The ultimate goal connects every task performed in CS, from cleaning to sterilization, directly to the well-being of the patient. While other options might be desirable, they are secondary to the primary objective of ensuring that patients receive safe, effective care, which heavily relies on properly processed medical devices. For example, every instrument processed correctly directly contributes to a successful surgery and a healthier patient. Ultimately, all central service efforts are dedicated to protecting and helping the patient.